Hi everyone, this is Dr. Kurt D'Amico of Kurt D'Amico Dentistry. This is my second video, still kind of amateurish here a little bit, but we're working on it. I have my wife now actually holding the camera. Last time you probably got car sick just trying to watch my video because it was bouncing all over the place. Hopefully that won't be happening as much today. In this second update, I wanted to on a very serious note, I wanted to let everybody know what we're doing here at the office. And in fact, I want to also explain why we have not opened up this past week. We were approved by, I have my kids here by the way, so a little disclosure there. Governor Cuomo gave the okay basically the day before last Monday. We held off because we did not feel like we were ready to go. In the sense of making sure that not only the patients were safe, but that our staff was safe. What I want to show you today is just a kind of a quick walkthrough of what we've changed and also what I'm going to look like, because things are going to look different to you guys, for sure. So, starting with that, I'm going to actually talk you through what's going to happen here, okay? First of all, I have my wife, she's kind of pointing over here. We have a piece of plexiglass here that is going to protect our front desk from any kind of splatter, accidental sneezes, things of that nature. So we have that to protect them up at the front. You're going to see a lot of hand sanitizers around. In fact, we have a hand sanitizer right at the door that's going to greet you guys as you come in. So the way we're going to do this is you're going to drive into the parking lot. You're going to call us. Audrey or Judy are going to come out. They're going to take your temperature, make sure that that is okay. They're also going to ask you the same questions that they asked you a couple days previously to make sure that you're not showing any of the symptoms or signs of COVID. So then we will allow you to come in. When you come in, you're going to be greeted right at the door, and you're going to, let me start the process here. You'll be taken directly into, hopefully, directly into the operatory, wherever, if you're having a cleaning or you're seeing me. We do have a waiting room all set up, same as before, but we're really going to try to make it so that nobody is in the waiting room. The obvious exception would be is if a parent brings a child in, the parent would be waiting out here in the waiting room. But I want to show you what we're going to be going through. You can see this gown that I'm wearing right now, and no, I'm not wearing it for looks, that's for sure. But these gowns we're going to have in the operatories, and they are not going to be leaving the operatories. So anything that gets on these gowns are going to stay in there and then be disinfected. We have what we call it's an N95, but it's called a KN95. And this right here is part of the reason why we didn't open up earlier, because we had to get access to these, which was very difficult to do. All of our staff are going to have these that are in the clinical side of things. I'm going to be placing this on. So you're actually going to see this. You can hear that it's even difficult to hear me through this. I'm going to place this on, make sure it's very secure. All of our clinical staff is going to be wearing these. I am going to have this will actually be on at the time I come in. We'll be wearing it all day. This is the coolest looking part of the whole thing. And as you can see, it sticks out far because I have my light and my surgical loops that are going to be on as well. So I had to get something that would give me the room for that. And then we are then going to place another mask on. And this mask goes over to protect that KN95 mask that we have underneath that. The reason for this is now this outside mask is going to be the one that's going to collect the aerosols and will be disposed of. We will be able to keep the other masks underneath. So I just want to show you, this is what I'm going to look like minus the loops and the light. Because of breathing purposes, I'm going to take this all off. It is unbelievable. I am a little worried about how hot all of us are going to be getting, but it's necessary. And I really want you guys to understand that this is, I guess at this point I will mention this, this is not just about protecting the patients or our staff or me, it's all of that. We could be having it and we don't want to pass it on to you. You could have it and you don't want to pass it on to us. That's how we're doing this. So quick walkthrough here. And if you catch my pasty white legs, it's because I'm wearing shorts. I'm not going to be doing that, I promise, when I'm working on you. But some of the room changes that we made, this is Sharon's room. She's got her gown hanging in here. You can see it's very sparse in here. And we even have drawers that are closed so we can hide things inside of there because we don't want aerosols to land on them. There's an air purifier over in the corner, but I'll show you in the next room. You can see what those air purifiers are. I actually have this one running right now. And that little glowing blue circle that looks kind of cool, that's actually an indication of a UVC light, which is proven to kill viruses. So anything that gets through the HEPA filtration will actually be hopefully killed. That's the whole idea. The other reason for these air purifiers that's overlooked is it's drawing negative pressure. In other words, it's drawing things towards it. So it's not allowing that aerosol to kind of spread everywhere, but it's actually drawing it to it and filtering it through. That's pretty much it. So you guys will not be too surprised. I really can't think of anything else. So, hey boys, come on over here. From my family to yours, we want to make sure that you guys are all staying very safe, staying healthy. Please take this very seriously. It is important. Obviously, family, you don't have to worry about it because we've been together for the last 3 months. But it is important that you take it very seriously. And what do we have to do, boys?
Stay safe.
Perfect.
Okay.